Good afternoon, my name is Alexander Campos. I am a current student at Robert Morris University, and this is my thesis presentation for my Health Service Administration's class, course number 4850. Topic is PTSD, current treatments, and holistic modalities. Start with what's PTSD? PTSD is an acronym. It stands for post-traumatic stress disorder. It is the emotional and physical response to a life-threatening event or trauma. PTSD can affect anyone, but is closely associated with the military and veteran communities. Symptoms of PTSD can affect individually physically, mentally, emotionally, and behaviorally. Common signs and symptoms are listed below. Now, please note that the individual may show or may not show all of the examples on the board, in the table, To be clinically diagnosed, the patient would have to present to the clinician with what's called symptoms clusters. They are avoidance, hyperarousal, or re-experiencing. Avoidance pertains to the person, or pertains to when a person loses interest in previous liked activities or people, will avoid situations that will remind the person of the event, while hyperarousal is being on edge, increased irritability and agitation, and hypervigilance, so always being guarded, re-experiencing, having flashbacks, nightmares, images, and constant replay of the events. It's considered a diagnosis if the signs or symptoms last longer or greater than 1 month. PTSD statistics. VA data shows that about 7 to 8% of the American population will experience PTSD at some point in their lives. For veterans, since 9/11, 2.5 million American veterans have served in the armed forces. 1.6 million of those 2.5 million troops have deployed in support of Operation Enduring Freedom, Iraqi Freedom, and Operations New Dawn. 20% of those who have deployed to either one of those theaters have been clinically diagnosed with PTSD, while only 50% of those who are suffering PTSD will actually seek help. So this is VA reported data for the PTSD rates. As you can see, the orange is 8% for civilian. Red is Vietnam. They have a 15% rate of diagnosis for PTSD. 12% for Gulf War, and 20% for OEF veterans. Currently, the VA uses what's called clinical practice guidelines. These are clinical decision-making tools that were developed interdepartmentally between the DoD and multiple disciplines. The resulting guidelines are thoughtful, data-driven, that can assist in the management and prevention of diseases and disorders. Current treatments for PTSD include cognitive processing therapy, prolonged exposure therapy, eye movement desensitization and reprocessing therapy, and medicinal adjuncts, which are selective serotonin reuptake inhibitors. So each one of these is what's currently being used for treatment of PTSD. While the efficacy of these have been shown for CPT and PE, they have been able to reduce symptoms but not been able to completely alleviate all symptoms related to PTSD. This is primarily attributed to high dropout rates and low follow-through on behalf of the patients. While SSRIs do improve symptoms, however, they do come with a slew of side effects that could exacerbate PTSD and can affect the individual differently. Increased suicide rates, increased suicidal ideations, and EMDR has shown to have an 80 to 90% success rate, but these are for single trauma victims. Throughout 30 controlled studies, they have shown that these have been the most promising treatment. However, for veterans who are deployed to OEF, OIF may be suffering from multiple events or traumatic injuries that is plaguing them, whereas EMDR has shown to alleviate symptoms, but only in single trauma patients. So a lot of these guys may have more than one event that's afflicting their condition, therefore may not be fully applicable for every veteran. So my idea is to use what's called CAM, complementary and alternative methods. The VA currently uses CAM therapies, but not as a full modality for treatment. My idea is to implement nutrition, exercise, and martial arts as a method to promote overall wellness on behalf of the veteran without utilizing any sort of psychomatic therapy or medicinal adjuncts, but more of a holistic approach. Alternative methods would be, as I said, nutrition, exercise, and martial arts. Nutrition, currently the United States has about 1/3 of the population of being obese. It puts 78 million people at risk for heart and metabolic disease, while obesity is linked to depression and could exacerbate PTSD symptoms in overweight veterans. Therefore, I believe that more emphasis should be placed on education, on the use of whole foods, supplementation, and key nutrients, instead of bad foods such as fast foods and unhealthy processed foods. And exercise has been shown to reduce PTSD symptoms in adults. In a study that showed that people who participated in a 12-session aerobic program had a decrease in overall symptoms. And then martial arts. There's a quote by Joe Rogan: martial arts are a vehicle for developing your human potential. They instill confidence, character building, promote healthy lifestyles and discipline, and I think that's a very beneficial thing for a veteran to kind of get back on the horse after getting out of the military. So in conclusion, I believe that anything is better than nothing. So whether or not the person wants to get alternative medicines, alternative methodologies, or proceed with traditional ones, the hardest thing to do is just ask for help. And I believe that anybody who is suffering from any sort of disorder should reach out and get the help that they need. That is it. I appreciate your time. Thank you for watching.